all you are doing is creating the potential to hurt people and making the life and the job of our healthcare givers and our officers of all ranks more difficult. And we can do without that. Thank you very much. So we are going to continue. The Minister of Finance is not here with us this afternoon because he is very busy working with his team trying to position us for next week. We will speak to you in this way again probably on Sunday afternoon to bring you up to date as to what would have happened throughout the weekend in preparation for the week ahead, because we are having to face the week not with trepidation but with confidence that whatever is available to us, we are bringing it to bear on this challenge. So if you have any questions for the officers or for any of us up here, before you do that, I just want to mention that the Minister of Trade and Tourism would have been here with us, but I did tell you yesterday that they would have gone on to Tobago. They are in Tobago now. They would have met with the Tobago House of Assembly this morning. The Tobago House of Assembly being the executive body that has responsibility for discharging these responsibilities to the people of Tobago. So they would have gone there representing the government in its fullest and interacting with the THA executive members to tell them what we are doing and to hear from them how we can further fashion our responses and to ensure that the people of Tobago are in fact well taken care of based on the tracks that we have set for the nation of Trinidad and Tobago. And the Minister of Trade informs me that in her committee's contact with the people who provide cable services, those persons have indicated a willingness to cooperate in bringing relief to those their customers, and more importantly, or equally importantly, the persons who are involved with that large number of people who are in the hire purchase business. A lot of people have obtained their items, their household items in particular, on hire purchase, which they would have obtained from our major houses, Unicoma, and their loans from I.A.N Finance and so on. The Minister of Trade's group have been in touch with these people, and I'm pleased to inform that they are in fact cooperating in crafting and offering elements of relief. So when the Minister is available, maybe on Sunday, she will give you a bit more detail on what is happening there. So we are working all around, whole of government, and I want to say whole of country. Let it be known that Trinidad and Tobago has buckled down, and we are facing this in a sensible and responsible way. We take your questions now, and if you do have questions, we'd like to have them now.
Good afternoon, Arvishi from TV6. Maybe Minister of Health could take this question.
Minister
of Health?
Minister of Health, yes.
So the CMO spoke of 258 cases, 9 confirmed positive. Is it that the rest were retained negative, or are we still awaiting results?
If the technical staff can stand by there, and if it comes to you, take it at the podium there.
Yeah, so since the beginning, the numbers that we have as in the first column, which is number that are tested, some of them would have been pending, and some of them would have been deferred for whatever reason. Some of them would have actually been tested positive for other things, for instance, H1N1 and the like. So the number that we have in the first column is numbers that would have been sent from Trinidad Public Health Lab onwards to CAFA. The positives are the positives, of course, that come back from CAFA.
And as we are presented, these 9 would have been persons who traveled themselves?
All of them, yes.
So from your inference at this point in time, it would be just about, I think our first case came in on the 12th, so we're just about 8 days in.
Yeah.
Would you have expected the virus to spread to close contacts by now, if it were to?
We have to wait the full length of the incubation period. So we have to go the 14 days from first contact to second contact before we can make that decision. Like, someone can present anywhere from the first day to the 14th day. So we have to wait the complete duration.
Okay, but yesterday you mentioned something about a 5-day window after presenting.
That is for testing. So from the onset of symptoms, for the first 5 days, that is when you have your highest yield and the most likely chance of a true positive test coming to you, or a true negative.
I think I've been doing some reading, like everybody else in Trinidad probably, and one of the criticisms 2 countries had in particular there was a delay in testing in the first few days, which would have led to the community spread. Would you have expected that this to present now? Because I know that our representative from CAFA did mention that we're going to expand testing.
Sure.
So is it that we'll be testing even mild cases?
No, we would have tested, we would have been using WHO's guidelines from the beginning, which includes the guideline that CAFA would have said. So anybody with symptoms, yesterday I went through the whole list of five groups of people that we would have been testing, and it aligns to the WHO group. I think CAFA is just going a little step further, just to make sure that member states are aware of the WHO guidelines, but we have been using that guideline from the beginning.
So it didn't change. I think, I'm not sure if Ms. Indar would have mentioned the new WHO guidelines.
Sorry. Yep.
Good afternoon again. So the guidelines, the definitions have been updated as from the beginning for when this started, but we wanted to clarify here that when we say we are testing all samples that are suspect or probable cases, that they must obviously face that, fit that case definition. And in all the definitions, whether you have WHO would have expanded their definition to clarify things more. So it's not that the definition has changed, it has been expanded so that people will understand that you must have symptoms. So that symptoms could be severe acute respiratory illness with a history of travel or acute respiratory illness with no history of travel but in contact with the case. So they expanded it to all the different possible scenarios so that people will be clearer. And what we have done is also clarified how we are testing, because I know there was a release probably a couple of weeks where we were testing 20 samples per country. So that was at that point where cases were now coming in, and we were looking at mainly the likelihood of imported cases. However, in that same release, we also spoke that if a country would have had a situation where they were doing any tracing, we would have tested. But I think, maybe that entire document was not read. So we wanted with this particular information just to say we will be testing all samples once they are suspect case, if they fit the suspect case definition.
And that is for Trinidad and Tobago or the other?
This is for not just Trinidad, but for all CAFA member countries, member states, if they request it. Because there are member states that can also do their own testing.
I just want to continue with the CMO, if he doesn't mind. We have taken a lot of initiatives, the government has taken a lot of initiatives to close borders, encourage people to stay at home. However, even when Dr. Tedros was addressing the world, I think it was 2 days ago, he mentioned that there can be low transmissions, and at the end of this isolation period, there can be a resurgence. Are we looking for that? What are we looking for?
Well, every country is at different stages of the epidemic. Trinidad had its first imported case, as you said, just a few days ago. So we are at the early stage of it. It came to the Caribbean region. I think we are one of the regions that the epidemic would have come to last. So we are at the early stage. We have to look at what countries would have done in the early stages of their disease and learn lessons from what happened in those places. We are learning lessons from what would have been done badly and what would have been done well in other parts of the world. And we think, of course, that we are at the early stage. So we have to wait and see. It's something that we have to take on a day-to-day, hourly basis. We're looking at the data, and we're putting all the measures in place as far as humanly possible to ensure that it does not escalate quickly, and we are flattening the epidemiological curve. That is what we are trying to do.
So for cases that would...
Mr. Wari, I'm sure your colleagues would want to have a question in, right? So if you this sounds like it appears as though we are doing a bit of a thesis here. I have one more question, and then I'll come to another one of your colleagues.
Dr. Rowley, Gonzalez from UC. I would like to know, will the government give consideration to specific amendments to the law to prevent churches and other groups from having mass gatherings? Because last night the minister said there was one issue on this, and then today in the newspaper there's one being advertised tonight.
I would like the Minister of National Security to read that, please. And against the background, that I did say before, nothing that we are doing here is about punishing anybody. It is all about trying to save lives and to protect our population. It has nothing to do with curtailing people's rights and expectation to worship their gods. It is about saving lives and protecting our yet unidentified persons. Minister of National Security, read that order.
Thank you, Prime Minister. The Prime Minister referred us to a short while ago an order that was published on the 19th of October in 1918 in the city of Kelowna, which was that was the name before Port of Spain, and I'll read it. Public notice. Notice is hereby given that in order to prevent the spread of Spanish influenza, all schools, public and private churches, theaters, moving picture halls, pool rooms and other places of amusement and lodge meetings are to be closed until further notice. It goes on to say, all public gatherings consisting of 10 or more are prohibited. So I think that makes the point.
Signed by whom?
And that time was signed by D.W. Sutherland, the mayor.
Let me just say something to the people of Trinidad and Tobago. I, as Prime Minister, I am in charge of managing the state's response, and I am also a citizen of this country going through the same stress that every other citizen is going through. I have very close members of my family in New York, in California. I grew up with my grandparents, as you know. My grandfather told me in great detail how they experienced the Spanish flu in 1918. We in Mason Hall, we still have 3 churches on the main road in Mason Hall. On the north is the Methodist Church, where I was christened. In the middle of the village, we have the Catholic Church on the main road. And on the south side of the village, we have the Anglican Church. There are some other churches there now. But those 3 churches were there when my grandfather was a young man, a very young man. And in 1918, he told me that there were days in the village where every afternoon at each church in that little village there were 3 to 6 or 7 coffins for funerals in the afternoon. Going to funerals had become a ritual in 1918, 1919 in what they called an epidemic year. That is what some of our citizens faced in this territory. Let us not take this thing as a joke. Nobody is preventing anybody from communicating with God. I think it is possible, even in the teachings of the Bible, to communicate with God without going to church. That's my understanding of it. But if in going and gathering, you're risking your life and the rest of lives in this country, please be sensible. That's all we're saying.
To the advice by the government, with the government be forced to force these people to gather in 10 or less?
The law provides for interventions. We have deliberately started out on this process by speaking to the population and relying on the good sense of the vast majority of people in this country. We knew that there'd be a minority that would not understand or cooperate, and as leader of the government, I did say that we do have a heavy hand, and we will use it if we have to. Today we passed legislation to allow our services to intervene in gatherings if we have to. Because at the end of the day, we are not going to lose sight of the objective. Do not congregate. It is when you congregate that you give the virus the opportunity to propagate and put all of us at risk. So please, let us not lose sight of the objective. It would be a real pity if we would have done so well and our healthcare givers are doing so well. And instead of getting the benefit of that, there are people who will be irresponsible, do exactly what we don't expect to do, or spread information that creates hurt where hurt is not to be countenanced. So those are two categories of people all of us want to appeal to them. One, those who want to congregate because they think they have to, and two, those who figure they have to spread fake news. Those two groups of people, you are operating to the detriment of the people of Trinidad and Tobago. And on behalf of the children who can't speak for themselves, on behalf of the elderly who are most vulnerable and exposed to your irresponsibility, on behalf of the healthy who are cooperating and can only do what they can do at their personal level, I'm once again appealing to all our citizens to do what has to be done. We are a small community, 1.4 million people. We are on an island. We have the possibility, the chance, because of who we are. Small number, 1.4 million. You know, 2 islands, or where we, or 2 or 3 or 4 islands, if we occupy them all in that way. If we conduct ourselves carrying out the protocols that our health experts tell us to carry out. We're not playing doctors here. We're not playing experts here. We are following the instructions given to us by our trained personnel. If we do that, we have a chance of minimizing our exposure and the deleterious effects of this virus on us. If we don't do that, we could go the way of all others, many of whom are suffering now because they do not have our initial strengths and they do not have the protection that our island nation offered us in the beginning, which we can spoil by our behavior. So let us see if we can get the best of what we have to start with.
I have a question for the Minister of Health. Which other countries are using our model for dealing with virus? Is it that we are using an already established model?
No. When we started off this in January 2019, I said specifically we are going to manage this situation by setting up a parallel healthcare system to deal specifically with COVID. Because you have to learn from other countries that are treating COVID-19 patients in their existing infrastructure. Take Italy, for example. It has broken down completely. A woman who is pregnant today in Italy cannot access a hospital bed to give birth. So we have to learn from that. And that's why I said from the very beginning, in setting up this parallel healthcare system, we will use Cora and Cuba, and if need be, the new facility open in St. James, and the new facility we are going to open in a couple of weeks in Costard Building in Port of Spain to provide secondary care and tertiary care so that the rest of the healthcare system goes on unaffected. That is the model. And others are looking at it to implement. It has worked well, and we are willing to share it.
But there's one thing we want to say, because I know we'll be meeting like this very frequently in the weeks ahead, and I don't want anybody to misrepresent what we are saying or what we are doing. The nature of this problem, it is quite possible that next week or 2 weeks from now, we could be dealing with different numbers, scarier numbers here. And it doesn't mean that it has collapsed. We want it to mean that we can still manage it because we have the structure in place to manage it. The real calamity that we have to stave off is not to find ourselves in a situation where the level of infection overcomes the healthcare delivery system. That's what we have to stave off at all costs. And as we do things to allow us not to be in that situation, the economic fallout we are trying to deal with on the other hand, and that is what the Minister of Finance and that is what our financial resources are being put to allow us to walk the road. We still have a long road to walk. I saw somebody saying in the American system yesterday morning, a very good analogy, It's a marathon. She said we're on mile 1. And if we are in this situation in mile 1, where are we likely to be on mile 24? And I thought that was a good way of putting it. It's a journey that we are on. As long as this virus is around, we are on that journey. And we have to ensure that at no point in that journey, we are unable to go put one foot in front of the other and go forward. We have done things. We are continuing to do things. We'll continue to do things to make sure that our health caregivers are kept healthy, kept safe, be available to the rest of the population, and that the hospital infrastructure, the physical infrastructure, the supply system, they're all there to keep us in a position to respond, because we will be called upon to respond. Yes?
Hi, Rosalie from CMC3, Minister of Health. My first question would be the 9 confirmed cases. Without revealing too much about them, how are they doing, as well as the 68 persons in Balandra?
Please don't ask the minister to do it. I tell the minister he's not a doctor. I know I have to.
Without saying too much, basically the all 9 cases are still within the hospital system, some in Cora, some in Couva. But they are the more severe ones are showing improvement day to day. The milder ones are doing well.
Good. Very good.
Sorry, in Balandra, they would have come in recently, so we would have had a few people developing mild symptoms. Of course, as we said, once you have symptoms, we will test. But other than that, mild symptoms meaning sore.
Available to the government in the healthcare system, which I've been repeating over and over, that we are relying on a body of doctors of all specialities who have been providing the state with their expertise, and the government has been listening to them, the government has been guided by them, and the government will continue so to do. So it was not anything out of the ordinary to hear from 2 doctors who are parliamentarians, because God knows we have been listening to doctors for the last 3 months, and we'll continue so to do. But I'm pleased to report to you that much of what those parliamentarian doctors were saying to us this morning are in step with what the other doctors have been saying, and the government's response is what we have been doing based on what the technical people have been saying to us. And the other thing is the use of resources to cushion and ameliorate the negative effects of the decisions we are taking, which is exactly what we've been saying to you, except that we have to understand, and I said so to Mrs. Prasad Bisesa, as a former Prime Minister, and our three colleagues there, you must understand that there's a limit to what the government can do in terms of providing financial support and financial interventions. The Minister of Finance committed a $6 billion program here on this response program in more ways than one. And so we were on the same page. The government has to find resources, and we found as much as we could. $6 billion is what we had not catered for 3 months ago. But we have to cater for it and use it now, focusing on those people who are least able to look after themselves. So I think we're on the same wavelength, and the conversation was very useful, and I dare say very civil. And we did ask the opposition leader, who did indicate that she had instructed that persons not engage in misinformation and fake news. And we did ask her to continue to do that, because that will help.
So Mr. Dayasing, I'm just wondering if we have an update on the hotlines that I know you've been moving on.
So the hotline is up, and we are testing it in-house with a select group of ministry employees and some members of the public to make sure we work out all the gaps, all the kinks. We have hired 10 doctors to man it. However, we are seeking to improve it with the help of TSTT. In addition to that, we are going to layer that hotline now with an app. Someone donated a COVID-19 app, absolutely free of charge to us. What that app will do will give you on your screen a list of questions to answer, some boxes to check, so that you may not have to speak to a person. What that will do, all the hotlines all around the world have collapsed under the sheer volume of calls. My daughter works in England, so I know. So we'll be launching the hotline next week. It's being tested now in-house and with some members of the public to work out the kinks. And we also want to do the app.
Yes, sir.
All ministers.
I didn't hear you.
I said Prime Minister, ministers, good afternoon. Angelo Marcel, Newsday.
Newsday,
Right.
please.
I visited a couple senior citizens' homes and differently able institutions, and they seem to be really ready for what is going on. That is one sector of the of those people, citizens. But I've noticed that the street dwellers are not really being addressed. They're all over the place, they're touching stuff, they're mingling, they're living in drains. What is really being done about that sector?
The Minister of Social and Family Services could probably respond to how we're approaching that.
Thank you very much for that question, and thank you for recognizing that the elderly and the disabled are well aware, because the ministry has been sending out guidelines to them. With regard to these street dwellers, as you call them, we have indicated on more than one occasion that there is a court decision, a judgment, that says it is within their human rights to be allowed to stay on the streets. First of all, that's the position in which we find ourselves. What we have done, though, is we have engaged the mayors and chairmen to indicate that what we would like them to do is put in place a move-along policy, which is that they use the police officers within their remit, which is not their first responsibility, but at least using these social development staff to get these people to move along and go into the shelters where we do provide assistance for them, and through the Ministry of Health we'll also be able to assess them, because at least 30% of them have mental health problems. But we are constrained by the judgment, And we are hoping that during this period, they will move along and go to those homes and shelters that are available. Sorry, and we have, as I said a short while ago, put in place a system where we'll be able to provide financial assistance to ensure that once they do go there, meals will be provided for them.
If there's no further questions,
but I'm wondering what is... Yes, I'm wondering what is WASA's role in this? The Minister of Social Development would have spoken about TNTech and other utilities, but we have received complaints in our newsroom about people not having a water supply at this time where they're being asked to wash their hands and keep their surroundings clean.
Let me answer. That's one of the points. That's one of the points raised. Yeah, that's one of the points raised by the opposition leader this morning. Even before we had a COVID-19 problem, we do acknowledge that there are areas in the country where the water supply is not as it should be, and in some communities it is way below where we expect it to be. The Minister of Public Utilities is working with WASA to ensure that in those areas where the water supply is at its worst, that efforts are made to ensure that all persons have a basic supply of water. But this is not a COVID-19 problem. This is a pre-COVID problem where we've had these pockets of people here and there where there's a very bad water supply, and there are other areas where the water supply is intermittent. And now we're in the middle of the dry season. You know, we're still on the water watch utilization. So this is something that the responsibility of the agency, WASA, and the local government bodies should be able to respond. Local government bodies, some of them have been saying that they have not been able to provide truck-borne water because they have not had financial wherewithal to do that. Now, I find that a little difficult, so I spoke to the and will keep speaking to the Minister of Local Government to instruct these people who are saying that to use monies that they have in their accounts to try and save lives. Last week a question came up in the Parliament, and I was surprised as Prime Minister, given what I'm being told on a regular basis about no money to provide water for people in local government districts, that local government districts across Trinidad and Tobago, Trinidad in fact, had what, was it 60 or $70 million in their accounts of what you call unspent balances, meaning that monies that were approved for them to spend on or whatever, and they didn't get the work done or the expenditure done by the end of the fiscal year, they are allowed to keep that money, and it's called an unspent balance. But to use it, they need to simply ask the minister for approval. And this is about $60 million of money in corporations, and the leaders of those corporations, in fact, one of the corporations that bleat the most about that had $17 million in an account called unspent balance. And if I go a little further, they know when to ask for unspent balance to do foolishness, but they don't know when to ask for unspent balance from the minister to get water for people. But they run to you in the media to try to make the government look bad by saying that they don't have water to wash their hands. Come on. If you have money in your account, unspent balance, getting the permission from the minister, because the minister has been instructed and is authorized to give permission to spend that money for anything. And it usually is spent on a development program item. We can spend it now on saving lives by washing hands. So I expect that that would not be putting us in a situation where people have no water, because we do have some resources in local government that could be directed for that purpose. And in the meantime, WASA and TNTech at the management level will take administrative decisions not to disconnect people from the supplies of water and electricity during this period. Vashi has another question.
A few days ago, Dr. Trotman, she would have told us that, you know, this COVID virus, it affects mostly elderly persons and those who are immunocompromised. Given that young people we see, not just locally but internationally, have been shrugging off these warnings, are you going to revise that, that advice, all persons at risk?
Okay.
So first of all, I think the Prime Minister will be glad to know I haven't touched my face once for the entire press conference. I get buffed for that. Anyhow, to answer your question, Ravashi, the epidemiology of that is changing. What you are seeing around the world, and the doctors here could confirm, is that more and more young people now in their 20s and 30s are coming down with it. That shows that young people are not as immune as they once thought they were. And we always said from the beginning, even though young people may not display severe symptoms, they will take it home to their parents, to their grandparents, and literally kill off their grandparents. So the advice is, as the Prime Minister has been saying, all of us are in this together. Everyone, young, old, child, everyone has to come on board with the leadership of the government for social distancing, washing of hands, cough etiquette, and don't congregate. Don't give the virus a chance to jump from person to person, because that is what will give you community spread and overwhelm your healthcare system. So the message to young people is simply behave.
Those that are at home in a home setting, you might have overcrowding there as well. Do you have any advice for persons? You don't just stay home and congregate. What do you do in terms of bathroom settings, different types of etiquette? I don't know. Sometimes we say take somebody tutor, eat from his plate.
Yeah, all of those things to me need to be revisited by households. There's an old saying, cleanliness is next to godliness. Now is the time to live that adage, that we need to be clean, our surroundings need to be clean. Don't share, if you have a child, you drink from the same cup as your child, you give your child your cup to drink from, as you say, juta. We need to get past those things now. And if we take the simple, common sense measures at home, we will get through this. We will come much stronger.
I think we've had a long session this afternoon. I just want to say to the national population, particularly those of you who work in media, to get a full appreciation for what we are facing, what we have been doing, and to probably compare where we at with others, you simply need to follow what is going on outside of Trinidad and Tobago. I understand that one of our Caribbean islands have just reported a significant increase in confirmed cases, which is a good distance away from where you were 2 weeks ago with 0. There are countries that are completely locked down, shut off, and cut off from the rest of the world temporarily. You would see a situation like, an airline like Lufthansa. Lufthansa has 763 planes. They have grounded 700 of those planes. And the week before, Delta grounded 300 planes. But of course, we are responding to these developments. Amazon is employing 100,000 people today to become couriers to carry food for people, because you can no longer go out to restaurants. Maybe in Trinidad and Tobago, we'll move from running down to the restaurants on the Arpita Avenue to some kind of courier services. Fortunately, we have some good technical possibilities. You can call up on your phone, you can follow on your phone. But this thing is going to change lives. It is changing lives. And we don't know where we're going to end up when it is all over. But in the meantime, we are part of a much larger gear that is spinning, hopefully not spinning out of control. So thank you all very much for the job that you're doing in informing the public, and we'll continue to provide you with all the information that we have available to us, and we will continue to be our brother's keepers. Thank you very much. The Minister of National Security wants to address something that didn't come up.
Thank you. It's based on the point that we made earlier, and I tried to emphasize it. There are international airports and sovereign countries taking decisions to close down, exactly as the Prime Minister just alluded to. There is nothing that the government of Trinidad and Tobago can do. For example, Venezuela has decided to shut its borders and to close down, and airlines are not being allowed to fly in. I am being bombarded bombarded here on my phone now by some members of the media saying that there's 70 Trinidadians in Margarita, saying that the government has abandoned them. I am emphasizing there is nothing that the government can do in those circumstances, unfortunately. It is a live situation. It continues to evolve. We will do as much as we can, but within the parameters of sovereign countries taking decisions to close their borders. So unfortunately, persons who are stuck in countries where there are no international flights in or out anymore, there's nothing that we can do.
Did you all see the invitations, the reduction in fares and invitations for cruises?
How much?
Have a good day, right?